Welcome to our training session on personal hygiene needs and techniques for assisting with activities of daily living. Hygiene and bathing essentials. Good hygiene is vital for health, confidence, and independence. Caregivers help establish lifelong habits, preventing infections and promoting well-being. Key areas: bathing, skin, oral, nail, hair, eye, ear, nose, sleep, and menstrual hygiene. Bathing guidelines: infants, bathe 2 to 3 times a week with lukewarm water, ensure drying and safety. Children, bathe 2 to 3 times weekly, increase based on activity. Adolescents, encourage self-care, privacy, and proper hygiene. Safety, always supervise young children, ensure warmth, and follow medical advice. Skincare for infants, children, and adolescents. Infants, delicate skin needs gentle care. Bathe 2 to 3 times weekly, use fragrance-free detergents, protect from the sun, and monitor for rashes. Children, more resilient skin still needs care. Bathe 3 to 4 times weekly. Treat dryness or eczema, and educate on wound care. Adolescents, puberty increases oil production. Cleanse, moisturize, use sun protection, and seek help for severe acne or eczema. Oral hygiene for infants, children, and adolescents. Establishing good oral hygiene early supports lifelong dental health. Infants, wipe gums twice daily with a soft cloth, brush emerging teeth with a soft bristled toothbrush and water. Avoid bottle feeding at bedtime to prevent tooth decay. Gradually transition from bottles and schedule early dental visits. Children, brush twice daily with a kid-friendly toothbrush and pea-sized toothpaste. Parents should assist younger children, teach proper brushing techniques, and ensure regular dental checkups every 6 months. Adolescents, maintain twice daily brushing and routine dental visits. Educate about the risks of tobacco, sugary drinks, and poor hygiene. Teens with braces need extra care, and those with disabilities may require adaptive hygiene tools. Regular dental visits and proper brushing habits prevent cavities and gum disease. Nail and hair care tips for infants, children, and adolescents. Nail care: infants, trim after baths using baby clippers, cut straight to prevent ingrown nails. Children, keep nails trimmed, dry hands properly, and check for infections. Adolescents, maintain regular trimming. Moisturize nails and monitor for fungal infections. Hair care: infants, use mild shampoo, wash 2 to 3 times weekly, and avoid harsh products. Children, wash 2 to 3 times weekly, use conditioner, and trim regularly. Adolescents, wash as needed, use suitable products, apply heat protectants, and trim to prevent split ends. Eye, ear, and nose care for infants, children, and adolescents. Proper care prevents infections, ensures comfort, and supports overall well-being. Eye care: clean gently, schedule vision screenings, practice hand hygiene, wear sun protection, and use protective eyewear when needed. Ear care: clean outer ears, avoid inserting objects, protect hearing, and seek medical attention for pain or infections. Nose care: use saline drops for infants, teach children proper nose blowing, and manage allergies in adolescents. Caregivers play a key role in reinforcing good hygiene habits for long-term health. Handwashing. Handwashing is a crucial aspect of personal hygiene at all stages of growth, from infancy to adolescence. It helps prevent infections, promotes health, and reduces the spread of illnesses. Teaching children and adolescents proper handwashing techniques encourages lifelong healthy habits. Parents and caregivers play a vital role in reinforcing these practices. When to wash hands: after using the toilet, before eating or preparing food, after blowing nose, sneezing, or coughing, after playing outside, after touching animals, when hands appear dirty. Steps for effective hand washing: wet hands with running water. Apply soap to cover all wet hands. Scrub all surfaces, backs of hands, between fingers, under nails, for at least 20 seconds. Rinse thoroughly under running water. Dry hands with a clean towel or single-use cloth. Proper handwashing prevents illness and ensures a healthier environment for children and adolescents. Sleep and menstrual hygiene. Maintaining proper sleep and menstrual hygiene is crucial for overall health and well-being. Sleep hygiene: keep bedding clean, limit naps, remove electronics, and follow a bedtime routine. Adolescents need extra support. Menstrual hygiene: change pads/tampons every 4 to 8 hours, dispose of products properly, and ensure access to supplies. Daily living and feeding support for infants, children, and adolescents. Activities of daily living: ADLs essential for health and development, including hygiene, nutrition, sleep, and mobility. Caregivers help children develop independence in feeding, dressing, toileting, and mobility, adapting support for those with critical illnesses. Feeding and nutrition supports growth and well-being at all stages: infants, breastfeeding or formula with safe preparation. Children. Introduce solid foods, encourage self-feeding, and monitor for allergies. Adolescents. Promote balanced diets, healthy snacks, and meal planning. Adaptive aids, specialized utensils and spill-proof cups help with feeding control. Dressing infants, children, and adolescents. Infants. Dress on a secure surface, use soft fabrics, support the head and neck, ensure a proper fit, and never leave unattended. Children and adolescents. Guide children in dressing, assist with motor challenges. Ensure privacy, and use adaptive clothing for medical needs. Adaptive aids, dressing sticks, zipper pulls, elastic waistbands, sock aids, and adaptive footwear help children with mobility challenges. Toileting guidelines for infants, children, and adolescents. Infants. Maintain hygiene with clean surfaces, fresh diapers, proper disposal, and thorough handwashing. Children. Toilet training begins around 18 months, 3 years, involving potty chairs, sitting posture, wiping, and handwashing. Some may need structured support, especially those with disabilities. Adolescents. Encourage independence and privacy. Address hygiene or mobility challenges and consult healthcare professionals for persistent issues like constipation or bedwetting. Adaptive aids, raised toilet seats, grab bars, commode chairs, and hygiene aids enhance comfort and independence. Mobility support for infants, children, and adolescent. Importance of mobility: supports physical, cognitive, and social development. Caregivers play a key role in promoting movement and independence. Developmental stages: infants develop strength through tummy time, crawling, and walking. Children and adolescents gain movement control, some need therapy or assistive devices for mobility and independence. Adaptive aids, wheelchairs and walking aids, provide stability and balance. Transfer aids and standing frames assist movement and posture. Gait trainers improve walking after surgery or rehabilitation. Caregivers and therapists ensure safe mobility solutions tailored to each child's needs. Thank you for watching the Personal Hygiene Needs and Techniques for Assisting with Activities of Daily Living module. Please answer the questions for this training before moving on to the next training module.